In this topic, we'll be understanding about why the patients develop constipation or where the problem lies or what could be the problems and why normally not everyone gets constipation. It's very important to understand the mechanism of stool formation because constipation means inadequate stool formation or inadequate stool passage. Now, we must know this stomach, the small intestine, the large intestine, this everything is total around 6.5-meter tube. So this small intestine and large intestine, it is comprised of 6.5 meter, means almost 20 feet, which is pretty long. So in that, the stool basically, for the formation of stool, what do we need? We need food. So just imagine that the food is not at all there. Then how can the stool form? To form a stool, we must have food particle which is digested, indigested. If this material has to be there, then only this can be passed in front. Then it can be passed forward. If this has not formed at all, it cannot pass forward. So for that you need food. In that also you need soft food. So how this soft food is created? It has to have water in it. If there is no water, if this is completely dry, this will not move forward. The soft stool can move very easily forward because of the gel type of texture to the stool. So if the stool is soft, then only it can be very easily passed further. If the stool is very hard, like stone, then through these tubes, the stone cannot pass. The stone cannot pass in so much tubes. A thing to pass through the tube, it is very important that it should have a gel-like consistency, a soft consistency, because a stone cannot pass. A stone will get stuck because this is tube and this tube is not placed in just like a straight tube. This is all curved. You get basically stomach, you have stomach, then you have small intestine, it is like this. So this is all small intestine which is placed like this tube, and then you have a large intestine which is ascending, then transverse colon, then descending colon, then sigmoid, then rectum, and then anus. So the food has to travel like this. So a hard stone like stool cannot pass, it has to be soft. So to form a fluffy, semi-solid or liquidy stool, you must have fibers in it. Because fiber is a structure which will not get absorbed in the blood. Fibers will stay in the gut. So this fiber will stay in the gut, all and all the other thing like glucose, sodium, potassium, chloride, all this will get absorbed in the blood. They will get all absorbed in the blood, but the fibers will not get absorbed. So the fiber will stay inside the gut, and which will help to form a stool. So we should have a fiber rich diet, which is seen in mainly fruits, vegetables, wheat, rice, curd, whatever food, vegetables we eat, whatever staples we eat like jawar, bajra, wheat, rice. This all has large amount of fiber. That is the reason why these fibers stay in the lumen of the gut and they form a stool volume. So, if it is very dry like a stone, this cannot be passed through the tubes. That is the reason why we need water. That is the reason hydration is very important. That is the reason why cooked food is very good. That is the reason why boiled food is very good. That is the reason why these things create a good quality stool. That is the reason why dry foods like uh, where their water quantity is much less creates a hard stool, and that is the reason why constipation is much common in those patients who eat majority of only dry food. which they don't take plenty of water or don't use cooked food or boiled food. The other thing is ki the the intestine is all like coil gut which is placed in the abdomen. So this the food has to pass and it takes so many hours. It takes around 1 to 3 days for that food to pass slowly from mouth up to the anus. That is the reason why if the patient has good mobility, if the patient ambulate himself, then automatically with the ambulation, like with the walking, running, jogging, cycling, or playing, automatically this will have fluctuations or this will create so much movement in the gut. So it will automatically accelerate the movement of the food from the gut. So that is the reason why doing exercises markedly improves the constipation. That is the reason why those patients who don't have mobility, like an elderly patient who is lying down on bed at all the time, those patients who have cancer, stroke, they don't move at all. They keep lying in the bed. So they don't increase the motility of the gut. That is the reason why constipation is very common in elderly patient. This constipation very commonly causes gases. That is one more problem. And we use so many drugs, especially so many anticholinergic drugs, which very commonly cause constipation. Now we should understand one basic rule. Okay, this all gut, it is moving. Why it is moving? It has to move. It has to propel the food forward. It will propel the food forward, and it will go to rectum and then anus. So why it will push the food? Because it is made up of muscles. This all gut is made up of muscles. So these muscles are all supplied by nerves. These nerves get impulses from the brain. This muscle, this nerve, this brain sends impulses to the nerves. This nerves gives impulses to the muscles. That is why the muscles contract and the food is propelled forward. That is the reason why food is pushed forward. That is the reason why the this food or this stool keep going from stomach to up to the anus. So here, basically, acetylcholine is the neurotransmitter which is released from the brain at nerve endings, which causes muscle contraction. So, we use so many anticholinergic drugs which actually inhibit this acetylcholine release, which actually reduce acetylcholine release. That is the reason why the impulses to the gut muscle is reduced and automatically the gut motility will be reduced. So, if these neurons, if these nerves don't release acetylcholine at gut muscles, then automatically the gut muscles will not contract. So, automatically the patient will have constipation. And we use so many drugs which have anti-acetylcholine activity. For example, we use tricyclic antidepressant, which is amitriptyline, nortriptyline. These are all anticholinergic drugs. We use very commonly antihistaminic, which is cetirizine, phenylephrine. We use dimenhydrinate, diphenhydramine. So we use so many anticholinergic like cinnarizine. These do have anticholinergic properties, and these anticholinergic properties causes constipation very commonly. We use salbutamol, salmeterol. These do have anticholinergic properties. So those drugs which we very commonly use, they very commonly have anticholinergic activity. In emergency, like we use atropine very commonly, glycopyrrolate very commonly. These medicines like ipratropium, tiotropium, these drugs which we use for acibrophyllene, Dairyphylline, doxophylline for COPD or asthma, for wheezing. They have significant anticholinergic property. That is the reason why the gut motility is reduced. So this is very important to know. These are all the things which causes the patient to have constipation. As I told, brain gives impulses to the gut muscles through the neurons by release of acetylcholine. So if someone has hypertension, if someone has diabetes, over a period of time, they get so many small strokes in the brain, so that brain itself gets damaged, so the brain itself will not give the impulses to the gut muscles, so they develop constipation very commonly. The same way, diabetes cause significant diabetic neuropathy. So this diabetic neuropathy will damage all the nerves of the body, which automatically causes damage to the neurons which are supplying to the gut muscles. So in diabetes mellitus, it's very common to get constipation. In diabetes, it very commonly damages muscles, all the muscles. So it very commonly causes damage to the gut muscles also. So automatically the patient will develop constipation. Those patients who have malnourishment, indigestion, stress related poor diet, they don't get good food, or those patients who are very poor, they don't get good food, so they don't get proteins, they don't get vitamins, they don't get trace elements, so automatically they lose muscles, so they definitely lose the gut muscles also. That is the reason why these patients get constipation very commonly. So these are all the reasons why patients do get constipation. So we must understand the problem, कि why the patient has constipation. So we should see whether the patient, whether he is taking insufficient diet. We should see the patient should at least get good quantity, good quality of food. The patient should take plenty of vegetables, plenty of fruits, plenty of staple diet like rice, chapati, wheat, bhakri, jari, whatever the food, they should get sufficient quantity of this food with good amount of water. They should ideally actually use boiled food or cooked food, which contains good quantity of water. Then only the stool can pass. If someone is drinking very less quantity of water, how can the stool be formed? If the patient has tendency of taking dry foods which contains very lesser quantity of water, then definitely the patient may have constipation. As I told, diabetic neuropathy damages all the nerves, which automatically also tells about that the gut muscles which are supplied by the nerves get also damaged. That is the reason why they won't give that much impulses to the gut muscles to contract. No impulses means no contraction, means no forward propelling of the food, means constipation. And the neurological disorders like spinal cord damage or brain damage, as seen in hypertension or diabetes or cancer, also very commonly cause damage to the gut muscles, damage to the gut neurons. Any abdominal surgery also directly causes damage to the gut muscles, damage to the gut neurons. Automatically the patient has marked increase in risk of developing constipation. Cachexia, because of the multiple reasons, the patient may have a road traffic accident, the patient may have poor nourishment, or the patient may have psychological disorders like stress, anxiety, depression, schizophrenia, that could cause them poor diet, poor appetite, that could cause reduction in his proteins, vitamins, minerals, water, food, and that will automatically affect his diet and stool formation. So these are all the problems that we must understand, behind which the problem of constipation lies. Thank you.